Bismillahirrahmanirrahim. Today my topic of presentation is Health Management Information System, its development, components, sources and uses of health information and health management information system in Pakistan and in Punjab. And my name is Dr. Khansa Junaid and I am presenting this presentation under kind supervision of Professor Dr. Saira Afsar. Success is not final, failure is not fatal. It is the courage to continue that counts. Learning objectives of today's presentation is introduction, objectives, characteristics of health information, domains and fields of various health information systems, sources of health management information system, steps in development of HMIS, benefits HMIS in Pakistan, routine health information system in Punjab province, problems or constraints facing Pakistan in HMIS and challenges, and some recommendations to improve the HMIS system in Punjab province, recent advances and MCQs. Learning outcome. By the end of this presentation, participants will be able to describe the introduction, domain, sources, steps, HMIS in Pakistan, routine health information system in Punjab, problems or constraints, challenges, and some recommendations to improve. Introduction. Health information system is that system in which collection, utilization, analysis, and transmission of information is done for conducting health services, training, and research. The basic objective of it is to provide reliable, latest, and useful health information to all levels of health officers and administrators, to amend health policies and working system on the basis of feedback, to provide information about periodically and time-bound programs for midterm evaluation, to contribute towards achievement of objective of health policies and programs, to increase efficiency and quality in health management. Health information system has some characteristics. According to WHO, the information we can receive should be problem oriented, it should be population based, it should be for functional and directorial wording should be used. Information should be expressed in short and imaginative forms, for example, graphs, charts, and table. Facility, there should be facility for data feedback must be present in health information system. There should be latest technology in health information system. Unnecessary figures or data should not be used or present. For health information management, organizational structure must be present. Some domains of health information system, it includes demography, vital statistics, health system input, health system output. Health determinants, health economics, health status, health infrastructure, resources, outcome, financial statistics, environmental health statistics. Now, sources of health management information system, where health information system come from. It can come from consensus, demography, vital statistics, for example, birth, deaths, marriages, notification of disease and disease registers, records and reports of hospitals, statistics regarding environmental health, statistics regarding health sources and the services. It can also come from sample survey, for example, national sample survey, population survey, statistics regarding to check epidemiological disease and research, school records, economic planning, plans of social security. It can also come through epidemiological surveillance, environmental surveillance, routine service reporting, specific program reporting, administrative systems, vital registrations. The essential step of elements of health management information system, it consists of input, data are selected on activities, then there is data processing, data is collected, aggregated, analyzed, represented on time. Then there is output of health information system, which include processed information. Basic steps in developing of health management information system. First step is planning and designing phase of HMIS. It ensures valuable information generation by HMIS. And the planning depends basically on objectives of program, situation analysis, budgeting, and development of software. Then come implementation phase, which is implementation of HMIS in any program. It is most expensive and time-consuming phase. It consists of training of manpower, report forms, report distribution, data entry and screen, software, data collection forms, transfer and processing procedures. Then come monitoring and evaluation, which include phase of inquiry into the performance of the program, and it includes periodic audits. This is basic steps. Now, the information which can generate from output, where we can use to measure the health status of the people and quantify their health problems and medical and healthcare needs. We can use it local, national, international health comparison for planning, administrative, and effective management of health services and programs. To assess whether health services are accomplishing their objectives, for assessing attitude and degree of satisfaction of beneficiaries. for research into particular problems of the health and disease. It serves as a foundation for planning of all public health programs. Resurvey of area at regular intervals are the most useful in monitoring the program which is being implemented. Facts about births and death, besides serving as indicator of population growth, we can use to focus attention on target group for specific health services. Morbidity data regarding various diseases in any area serve as an index of state of health of the population. Records and reports received from periphery are very helpful for taking operative and administrative decisions. It also helps to planning health in education programs, gives a supervisor an idea about quantity and quality of work being done in any area. Now, benefits of health management information system. It helping decision makers to detect and control emerging and endemic health problems, help in monitoring progress toward health goals and promote equity, empowering individuals and community with timely and understandable health-related information, improving quality of services, strengthening the evidence base for effective health policies, permitting evaluation of scale-up efforts, mobilizing new sources, and ensuring accountability in the way they used. Now, what is the role of health team in maintenance of health information system? Health team interact with user groups. It identify the needs of users, designing of reporting formats, identify system of information flow, ensure smooth flow of health information within and outside the organization. It acts as an interface between sections and management tiers, identify the training needs of staff, organizing monthly periodic meetings to assess the performance, maintenance minutes, and follow up on decision, interface with various divisions and units in the organization for health information sharing. Now there is the routine health information system, which is also known as RHIS, which is actually called a information which is health facility and community information system, which generate data at regular intervals no longer than a year that have been collected at a particular period but not longer than a year that has been collected at public and private health facilities and institutions as well as community level healthcare posts and clinics. This information, HMIS system include both routine and non-routine health information system. The routine health information system is also often referred to as facility-based health information system. While the non-routine routine health information system includes population health unit surveys, population consensus, rapid assessment procedures, integrated community health information system. In developed countries like Canada and some developing countries, for example, Malawi and Tanzania, there is single integrated community health information system. In Ethiopia, the Ministry of Health introduced a community health information system to capture basic health and health-related information by health extension workers at the household and individual level. Now we can see health management information system in Pakistan. Health management information system in Pakistan is first formal routine health management information system in Pakistan, which is entitled as Health Management Information System, was established in Pakistan in 1992 with a support from US aid. The HMIS covered information from first level healthcare facilities only primitively, for example, basic health units and rural health center, but after a devolution of power in 2001, a discussion began about revamping the health management information system and bringing secondary level healthcare facilities, for example, Tehsil headquarter hospitalization and district headquarter hospitals into information net. Consequently, the district health official through this after devolution in 2001, this health management information system in Pakistan now become the district health information system, which HMIS as renamed as DHIS, which is launched in 2006. DHIS is the district health information system, which provides data for district planning, implementation, and monitoring of major indicators of disease pattern, preventive services, and physical resources. This is the Pakistan Health Information System websites, and you can see health management information dashboard. It includes DHIS dashboard, lady health worker, immunization, Sehat Sahulat Scheme, MNSCH, tuberculosis, HIV/AIDS, malaria, nutrition, polio, hepatitis, vaccine, and contraceptive. There is integrated dashboard also, for example, SDG3 progress in Pakistan, integrated AIDS, TB, and malaria program, National Integrated Dashboard, district revamping based on KPIs. There's also surveys is uploading, for example, PDHS, HS, MICS, and various mutation surveys. Now, health management information system based on request from government of Pakistan, Japan in cooperation association implemented the study on improvement of management information system in health sector from 2004 to 2007. Through this study, a new health system called DHS was developed, and National Action Plan for nationwide prevalence of district health manager information was approved at the steering committee through Japan committee. This project summary is to scale up the strategy for DHIS approved at the Joint Coordinating Committee. MOH staff is adequately trained on DHIS cooperation. The DHIS data are collected in complete, precise, and timely manner. The DHIS collected are entered into DHIS software, processed and analyzed. By using the result of analysis data, the items for resource allocation and budgeting are identified. The DHIS is adequately coordinated among stakeholders. Through this project highlights, it consists of installation and maintenance of DHIS software, DHIS training on data, collection, training of data entry and analysis, training of use of information, training of DHS district health officer implemented by provincial master trainers, and monitoring and evaluation of district health information health system through this data, which is project of Japan. Now, the routine health information system in Punjab province. The health management information system in Pakistan. In Pakistan, actually, health is the provincial responsibility, with the federal government coordinating among provinces, formulating overarching national health strategies and policies, and helping provinces to implement donor-assisted vertical programs. In the province, health sector follows the administrative structure with the Ministry of Health, Administrative Secretaries, and Director General of Health Services at the top. While in each district there is Executive Director Health Officer, and then there come the Deputy District Health Officer at the Tehsil or Sub-District level. For example, reporting mechanism in District Health Information System, there is Department of Health. The name of, for example, is District Health Information System. Data entry at provincial level, provincial MIS cell, then district entry at district level, DHIS cell at district level, then data compilation. For example, this is example of family planning, the lady health visitor, then data collected by LHVs at public first and second level health facilities. For example, there is example of lady health worker MIS system of maternal and child health and nutrition. There is sub-department at provincial level, this nutrition program, national program on primary health care and family planning, maternal childborn. Name of this is lady health worker MIS, and data entry compiled at district health officer by computer operator. Then data compilation, lady health supervisor prepare the district monthly report. Then data collected by lady health workers who provide services to the community, visiting door to door. This is actually hierarchy and how the health management information system is developed. The routine health information system in Punjab province, Pakistan, and the Punjab is actually with estimated population of 100 million, is administratively divided into 36 districts. It has extensive publicly and private managed healthcare delivery network in all districts. It is organized in the following 4 tiers, which is known as Punjab Evolved Social Services Program. Outreach and community-based services with a focus on immunization, sanitation, malaria control, maternal and child and family planning. Primary or first level healthcare facilities, which is VHUs and RHCs. Secondary healthcare, which is include Tehsil headquarters, district headquarters. Tertiary healthcare, which is also serve as teaching facility in major cities providing specialized care. The private sector is also present, consists of individual clinics or small office-based practices of general practitioner, medium and large hospital, laboratories, and pharmacies. Public sector health facilities report to DHIS, while about 5% of private sector facilities report data and have practices that could be termed as HMIS. The routine health information system reporting is actually recent survey is the district health information system, which is now replaced as HMIS, is fully computerized in only 10% of public sector health facilities in Punjab, and partially computerized in 60 to 60% of other public facilities. Therefore, almost all public facilities, 92% report to executive district officer, while 93% reporting monthly. Through regular reporting is good, data for most indicators are not gathered correctly, and there is no feedback system from DHIS to the reporting system, though data is corrected. Therefore, there is a gap exists in the current HIS in the Pakistan. For example, reproductive health data from different sources, whether public, private, community, or facility-based, as the data is not integrated, consolidated. The quality of data, DHIS data is questionable, especially in its completeness, correctness, and timeliness. Because of functional gap between community and facility, community-based health workers do not provide full coverage of services, and this provides partial data. And another gap is uptake of data from community by RHIS is inadequate. There are also barriers, and most important barrier in RHIS system recently identified is socio-cultural and religious barrier, which further expand the gap in the quality and adequacy of data. As a result, information generated through routine health information system is seldom used in the decision making at different levels. And there are also problems or constraint of health management information system overall in Pakistan and also in Punjab. For example, first problem is structural problem. For example, there is multiplicity of institution and department, fragmentation of data, lack of infrastructural facilities for storage and maintenance of record, procedural, which include excessive information system, exhaustive information seldom used, overburden of collection and recording of data, incomplete, unreliable information, repetition of general information, inappropriate forms, less interest of users in information, time-consuming process, confused coding, absence of feedback to information suppliers. Related to content, there are constraints, mostly service utilization statistics, only summarized information reaches at higher level, less emphasis on socio-economic information, no user-friendly. Related to human resources, absence or lack of skilled medical record, lack of opportunity for in-service training, healthcare provider, nurses, biomedical trained persons are collecting and preparing data. There is also lack of motivation and extra incentives. If we see technological problems or constraint, there is much manual paper-based system, absence or lack of computerized database system, low levels of public will about vital registration system, inadequate government capacity, and lack from political decision, gender issues in vital events registration, fragmentation of health information, establishing a uniform information system within a country's problem. Therefore, there is some recommendations to improve health management information system in Punjab province. Some are the shift the paradigm. Now there is a time to shift that paradigm from individual level healthcare approach to family centered approach. Because if we see the current health information system in Pakistan, it is not based on family oriented healthcare delivery approach. Rather, it is based on individual members. For example, if family or household member has 6 members, for example, mother, father, their data is not available in central location to assess the health needs of one family. For example, if we see from individual level healthcare approach to family centered, for example, immunization team records vaccination data from children, which is stored in one place. LHV records family planning data, which is for parents is stored in elsewhere, while the CNIC of each Pakistani was collected as unique family number. Yet community health workers do not use it to maintain records. Rather, they generate new client number and they don't use CNIC number. Therefore, fragmented data not only in terms of family record but also with data in different healthcare areas, because there is no single number and family-oriented number, and data is collected but in fragmented form, as I already described in example. Therefore, a second recommendation is to promote a culture of inter-organizational information sharing system to remove duplication of information. Only recent few decades, 10 years, one department in Punjab, for example, Population Welfare Department, providing space to upload data from other departments or organizations, including LMIS, and encouraging department or organization to share their data from Population Welfare Department. But this does not occur on regular basis. Reason is there is lack of cooperation and culture of inter-organizational information sharing in Punjab and also in Pakistan. And second recommendation is to sensitize health care professional officials on the benefits of integrating community level data into routine health information system, because most of the key informants did not know what a community health information system is. Some confuse the community health information system with simple community level data collection. But therefore, there is need to raise awareness among officials who manage health information system about community health information system, what it entails and what its significance, so they can work to integrate data to make better healthcare decisions for communities. Therefore, health management information system is actually collecting the data which include common data sets, centralized repository tracking, monitoring, various measure outcomes, evaluation, and then the triage, address healthcare needs. First, then there is less duplication, meet needs with services. Now come recent advances. The paper is published recently in 2019, which is Understanding Performance Data Health Management Information System, Data Accuracy in South Nation in Nationalities in Ethiopia. This is conducted research. According to this research, health management information system is a system whereby health data are recorded, stored, retrieved, and proceed to improve decision making. The data quality should be monitored, and therefore the study is assess the accuracy of routine health management information system in data. This is facility-based cross-section study and is conducted in Southern nationalities and population region in 2017. Document reviews was done in 163 facilities, and SPS is used for data analysis. Results shows that though inaccuracy was noted for all data elements, 96 and 94% facility reported institutional maternal death and stillbirth attendance within acceptable range, with confirmed malaria antenatal and care visits, postnatal care fully immunized, severe acute malnutrition, total malaria. Antenatal care visit was overreported by 24%, while total malaria was underreported. Reasons for variation include technical, behavioral, and organization. This study concludes that majority of facilities reported overreported services while underreporting disease. Therefore, data quality should be monitored routinely against data quality parameters, quantitatively and qualitatively, to catch up country's information revolution agenda. Another paper is published in 2017, which is include assessment of implementation of health management information system at district level in southern Malawi. This the system is actually health management information system established in Malawi in 1999, and the country lack accurate, reliable, complete, consistent information. Therefore, its background is to determine the reliable and complete information health management information system assessment. The cross-section is conducted. It use both qualitative and quantitative data collection method, in-depth interviews, document reviews, and focus group discussion. It target the 10 HMIS officer and 10 district health managers from 10 districts. The study result shows that based on Ministry of Health minimum requirement, 1 out of 10 HMIS officer was qualified for the post, and HMIS officer stated that HMIS data collected from district health of hospital, health facilities, and community, including medical assistant, nurse, midwife, statistical clerics, and health surveillance assistant. Challenges with system include inadequate resources, knowledge gap, inadequacy of staff, lack of training, and refresher courses, which collectively contribute to unreliable information and therefore poorly informed decision making, according to respondent. Conclusions: this study include that inadequate qualification among the diverse group of data collectors, along with varying availability and utilization different data collection tool. Therefore, HMIS was useful for development of district implementation plan and planning for other projects. According to the study conclude, to reduce data inconsistencies, HMIS indicators should be revised and data collection tools should be harmonized. Another data also article is published in Pakistan regarding perceptions of physician regarding implementation of hospital management information system in tertiary hospital setting of developing country. According to this, health management information system are being adopted increasingly in a tertiary hospital in developing country like Pakistan, with the aim of improving physician and patient convenience. The objective of this study is to assess the perception of physician regarding the newly implemented HMIS system in tertiary setting in Pakistan. It is actually a cross-sectional study which was conducted in all the departments of Gurki Trust Teaching Hospital, Lahore. Total 145 physicians was varying specialty units fulfilling the inclusion criteria were included, and a span of 6 months, including July 2020 and December 2020, was collected data. Data was collected using structured questionnaire. The result shows that the sample population consists of 80 males and 65 and 44% females, with the majority of respondents having 1 to 5 years of clinical experience. Of total, 61% knew about the term HMIS, while 71% of participants responded that no formal training was provided to them before the implementation of HMIS. Overall, 77% responded agree that formal training should have been conducted before an implementation of this system. And 77% respondents also considered aids to review patient history as the biggest advantage of HMIS. And 54 considered being paper-free, 53% considered the facilitation of data analysis. But disadvantage, according to this study, 75% respondents considered HMIS to be time-consuming, and 57% considered hindrance for smooth running of clinical work. This study concluding that implementation of health management information system was found to have significant advantage in the opinion of physicians, such as, for example, aids in reviewing patient medical records, data analysis, providing paperless patient care. It should nevertheless be preceded by formal training of all physicians regarding its use, but many physicians consider to be time consuming, especially in circumstances where the patient workload is overwhelming. Now there is time for MCQs. MCQs 1. Health information refers to data about person medical history which includes symptoms, diagnosis, procedures, and outcome according to World Health Organization. The health information for effective health management information should be alpha individual based, B long and it's extensive, C non directional functional, D problem oriented, E unidirectional. What will be the correct option? Delta will be the correct option, that health management information system should be problem oriented. Therefore, it should not be long and extensive, non-functional. Therefore, Delta will be the correct option. Health information system should be problem oriented. MCQs 2. A growth monitoring and promotion program for under 5 is launched in ABC community. After 6 months of evaluation, the program supervisor discovered that the number of malnutrition children has remained stable, while the number of severe malnutrition and death has increased. The most likely cause is information alpha flow led to the supervisor. B, supervisor was given irrelevant data. C, the definition of collected variables vary. Delta, the system has no built-in feedback system. Alpha will be the correct option, as in the scenario you can see that the 6-month evaluation program supervisor discovered the malnutrition is stable, while the number of severe malnutrition death has increased. The main reason in HMIS system or any program is that the information flow late to the supervisor. Therefore, there is timely flow of information system. This is the most critical point in HMIS. Therefore, alpha will be the correct option. MCQs 3. The Executive Director Health Officer receives quantitative data about population vital events such as births, death, marriage, and divorces from the ABC community Deputy District Health Officer. HMIS sources in this scenario are alpha consensus demographic vital events, beta economic planning, C environmental health statistics, delta notification of disease and disease register, E school health records.
A.
Alpha will be the correct option, as you can see vital events, deaths and marriages, consensus demographic vital events should be the correct option. MCQs 4. Health workers visit homes and address families' contraceptive needs. A public health team planned to develop an HMIS for family planning program data in XYZ community. Which of the following step in HMIS development is the most time consuming? Alpha designing phase, beta implementation phase, C monitoring and evaluation, D planning phase of HMIS.
Implementation phase.
The correct option is beta. Implementation phase is the most time consuming and most time consuming phase of HMIS development. Therefore, beta will be the correct option. MCQs 5. A well-functioning routine health management information system provides the information needed for health system planning, governance, accountability planning, and policy, surveillance, and quality management in XYZ community. The routine health management information include which of the following health information below? Alpha electronic health records, beta environmental surveys, hospital unit-based survey, D population consensus, and E population-based survey. What will be the correct option? Alpha will be the correct option. Electronic health records of tuberculosis patient, as I already mentioned, that the routine health information system include the facility-based health information system of any patient. Therefore, other options are not facility-based. MCQ 6. Routine health information system are defined as system that provide information system at regular intervals to meet predictable information needs. These include paper-based or electronic health records and facility and district level. The routine health information generates data at regular interval of less than 4 months, beta less than 9 months, C less than 6 months, delta less than 3 months, and E no longer than a year. What will be the correct option?
E.
E will be the correct option, no longer than year that it generates at regular intervals. So E will be the correct option. MCQ 7, environmental disease, especially waterborne disease, cause 10% of all deaths in XYZ community. Deputy District Health Officer, the executive officer receives the XYZ community district data quantitatively and forward to Executive Director Health Officer. HMIS sources in this scenario is the alpha consensus, demography, vital events, beta economic planning, environmental health statistics, notification of disease and school report events. What will be the sources of health management information in this case?
C.
C will be the correct option, as you see that waterborne diseases come in environmental disease. Therefore, environmental health statistic is the answer. C is the correct option. MCQs 8. District Health Information System, which is now replaced in HMIS, is fully computerized in -% of public sector health facilities and partially computerized in 62 to 60% of other health facilities in Pakistan. Alpha 5%, beta 10%, C 15%, delta 20%, E 25%. Beta will be the correct option. I already mentioned in recent surveys that in Pakistan, only 10% of public sector health facility is the public sector fully computerized. Well-functioning routine health information system providing information needed for health system management for governance in the ABC community. Uptake of data from ABC community by RHC is the in the ABC community. Uptake of data from ABC community by RHC routine health information system is inadequate. The most important cause that further expand the gap in the quality and adequacy of data in the routine health information system is alpha language barrier, beta organizational structure barrier, C psychological emotional barrier, D social cultural religious barrier, E technological barrier. Delta will be the correct option, as I mentioned in challenges or barriers faced by routine health information system developing countries like Pakistan is a socio-cultural religious barrier recently faced, which further expand the gap in the quality and adequacy of data in the routine health information system in Pakistan. No doubt other barriers are exist and can cause gap in the adequacy of data quality, but delta is correct option in this case, which is the most important cause. MCQs 10. The quality of district health information system is questionable in the developing countries, especially in Pakistan, regarding its alpha completeness, correctness, and timeliness, beta excessive information, C exhaustive information, delta overburden of collection and recording of data, E repetition of general information. What will be the correct option? Alpha will be the correct option, especially in Pakistan. The district health information data is the questionable because no doubt it is there is exhaustive information, excessive information, overburden of collection, recording of data, repetition of general information system. But most important regarding this completeness, correctness, and timeliness of the health information data. Therefore, alpha will be the correct option. This is the key of my MCQs, and thank you.
Okay, thank you very much. Very nice presentation. It is very important, informative, as well as essential part of your training to know about the HMIS system. And the best part is that all the problems that have been correctly identified and the recommendations were based on those problems that have been already charted down by Dr. Hansa. So the recent advances, even these are from the countries like Malawi, etc. But they are equally applicable even in this scenario and context of Pakistan. Another important observation that I made during this presentation is that the MCQs were very simple and straightforward, but the students were unable to identify the option that has been given in multiple choice question. regardless of the fact that the presentation contains all that information that was placed in the MCQs. So I must say that every student who is listening to the presentation, the MCQ is the part where we get this information, how many of you are enthusiastically learning and participating in the session. I would suggest that in next sessions, everyone must give the answer. Whether it is correct or incorrect, it doesn't matter. The thing that matters is the participation. The second important thing is, as this is a very important subject, so tomorrow on Saturday, I would take the written examination of HMIS system in the department. So everyone should be at 9 a.m. in the department on Saturday, and they can leave the department after 30 minutes, right? At 9:30, you would be free.